I'm thinking, of course, that nursing has certainly become a secular profession, but the cultural invention of and secularization of the Good Samaritan guide of not only taking care of one's own family, but compassion for the stranger, and is very much a part of the tradition of social justice, of advocacy in nursing practice, and that we would have this really wonderful cultural invention of the intimate stranger who would care for someone who's very ill, and when the family members might not be able to hold up the caregiving activities simply because of lack of knowledge, or because their world was crumbling in the sorrow and the confrontation with the suffering. So I think that it makes for a very interesting cultural history of nursing and its contribution to a good society. It's very much a part of the civic professionalism of nursing.
I have another question, I guess, back to your study. I was thinking of, because I know you talk about, you talk a little bit in your recommendations that we need to approach educating nurses from a cognitive apprenticeship method. Mm-hmm. And so I wondered if you'd talk a little bit about that. And my understanding is it's really shifting students from thinking about understanding as knowing enough, having enough information, to how do I apply that knowledge in a strategic way?
Well, the cognitive apprenticeship is very robust in all the professions because you have to have the scientific knowledge behind your practice. You certainly can't have ethical practice without good knowledge formation. But it isn't enough to have an abstract conceptual approach. You have to have that, and it isn't enough to have abstract decision-making models that are formal. You really have to have a vision of the role of practical reasoning in business, in medicine, law, clergy. It's the reasoning across time about the particular through changes in the patient and changes in or changes in the clinician's understanding. That's a form of practical reasoning, and probably clinical reasoning is the very best metaphor for practical reasoning. It's really an analog for practical reasoning. Academia hasn't done a great job with practical reasoning. Typically, academia has preferred formal decision-making models and has had a much more robust focus on critical thinking, which is very important. But it's necessary but not sufficient. And physicians and nurses and clergy members, lawyers, have to have a place to stand and a way to act. So you have to have a background of knowledge from which to act. And it can't just be decontextualized abstract knowledge, but knowledge that is grasped in relation to actual complex practical situations.
Well, I think you